Okay, I loved it during all the years that Gordon Gee was president of the university because he was a real short guy. And every podium on campus had a little box behind it so that short people could stand at the podium. Ever since he left, I'm left with standing next to podiums. Okay, so here we go. So I am going to be talking about this topic of disseminating research, and particularly with participants and communities. When we think about dissemination, a lot of times the thing we're focusing on is disseminating to our colleagues professionally, and obviously that's important, but it's also, in the community engagement sense, important to think about the people who participate in our research studies. So I will be talking about sharing with participants, organizations, and community groups, obviously talking about the sharing of aggregate results. I'm not talking about how any individual who gets feedback about their own health status. I'm talking about study results, and I will be talking about when and how to do this. So then kind of the outline, in what circumstances would you consider doing this, how to do it effectively, and some of the complexities, because it's not entirely straightforward. So circumstances, obviously, to the extent that your research is actually involving individuals and communities and has some relevance to their lives, people may have gotten involved because they were interested in research and the research process, probably got a good pep talk in the beginning about their importance to the research, and they frankly, are a little bent out of shape when they get sort of left behind at the end. They don't know what was ever found. Certainly any research that could impact the reputation of a community, so that if you're doing community-based research in a particular area of town or a particular small town or a particular region of the country, and you're going to, in your results, it's going to be obvious that that's the area that your research pertains to, then the people of that region have some sort of input or need to know what it is you're getting ready to say about their area. And finally, if there's been substantial input from individuals, from organizations, if you have community partners, if you have groups who helped you recruit, if you have groups who facilitated your data collection, these groups all have some kind of investment in wanting to know, well, what did you learn? Why do we share these results? We may be providing communities with useful information about their own health status. In some ways, we're showing appreciation for the efforts they have made. And it really is going to improve relationships with these communities, which in a way, is sort of blazing the trail for your own future research and for the next researcher who comes along. So this looks remarkably like that video is not operational. Let me see if I can, nope. Let's see if we can get the YouTube version to come up. I'm going to try to move it forward because I didn't want all of it. Okay. I'm just going to do a minute or two. And before I start this, let me tell you, this is a video that we made a couple years ago when I was doing research in the south part of Columbus and involved a lot of communities and organizations. And we went to the community and we asked various questions about what it's like to be involved in research from the community's perspective. And there's just a little clip out of this that I wanted to show today.
Because you don't really even think that far.
You fill out the surveys, you answer the questionnaires, and you don't know what happens to the information.
Typically, the researchers have not really cared enough about their subjects to bother getting back to them.
oftentimes we know when things start and we know when they end, but we don't know the results. So
sometimes this information is just collected for a project and put in a file cabinet. I think that's really bad business.
Building trust, I think, really requires that once the research is done, that folks hear back what it learned and what kind of impact it's going to have.
You come in and ask us a real poignant question, some really questions like, oh yeah, they're finally going to come in and work on my issue, and then nothing ever happens. And see, I just knew it was just a game. They just come in here. Next time, did they have no she but bother knocking on my door because it's just a waste of my time.
I think that if they would concern themselves with thinking of the community or the specific area that they're targeted as somebody who is important, and they are important, that would make a big difference. And I think they've got probably a better response from those people as well.
All right, we will stop there. Okay, so I know that the audio isn't the greatest on that, and the link to the whole video is on the bottom of the slide, so if you have the slide, you can always view the whole thing if you want to. But basically, the people in that clip were either community residents or a couple of social service agency people who deal with research, sort of facilitate it happening in their communities, and it was their responses to what's it like to be involved. And I think the comment about, we fill out the surveys, we know when things start, we know when the data are collected, and we don't know what happened, we're not told. Or the guy who said, the next time don't bother knocking on my door, because I don't know what came of that research. So that's why it has become really important for us to think about how can we involve communities, and not just at the beginning, not just at the recruitment, but all the way through in terms of understanding and disseminating the results. So the kind of themes that I picked up from that segment of the video, community trust in the researchers and the research process, respect for the community, the need to have continual participation from communities, that it isn't sort of a one and done. It may be for you, but there's somebody else wanting to do research. And frankly, some of these communities see a lot of researchers. And so we are, all of us, establishing the reputation for the next group that comes along. And the communities wanting to be involved in helping to understand, interpret, and make use of the research. And in my experience, sometimes can see, at least for the types of research I do, some rather creative ways to interpret and think about the research. It's easier to be communicating your results if if you have a partnership that has existed from the beginning. If you have groups that have been active with you all along, so not just touch bases, not just sign them up to a community advisory board at the time you're writing the grant and then they never hear from you again, or get letters of support and that's all that ever happens, but actual back and forth, ongoing involvement makes it much easier, because then you have a natural forum for giving results. Partnership does involve a two-way interaction, that we both share the research and hear others' perspectives on the research. I know that a lot of projects do participant newsletters. Sometimes those are great. Sometimes they are kind of one-directional, with the research community saying things to the participants, but no, the participants, not having any forum for really giving their opinions. So I think that two-way communication is very important. So some sort of regular meeting, feedback, even face-to-face, if that's the appropriate way of doing it. And for your own research, there's going to be different ways of doing it depending on exactly what you're doing. Who do you want to include? Study participants. Community groups, it may be larger than just the direct participants. If you had groups who helped you formulate, understand, move into the community, maybe, as I said, helped you recruit. If you were working with local churches who said, yes, we can recruit participants for you, or you were working with local community providers who helped recruit participants, they're invested. They want to know, well, what did we learn? And community service providers who may be interested in the results of studies that affect their clientele. So how do you share them? First of all, you have to think about the needs of the group you're sharing with. Literacy levels can be different in different populations. So written communication can be fine, newsletters can be fine for some groups, but not so much for others. Plenty of groups for whom a written communication is just not the way they like to communicate or like to hear things. They like a more sharing format. So you do have to think about that. How do they like to get communications? And you need to think about that. What is it from the research that they most want to know? It may not be the same things that you as a researcher were trying to get out of it. And then often it's helpful if you pilot test your materials and get feedback. I'll tell you a little bit. So if you're doing written communication, like I said, the literacy needs, you may need to do multiple versions for different populations, and you need to think how you're going to distribute it. Is it email? Well, do your people have email? Do they communicate? Is that some way they communicate? Can they get an attachment? Is that a possibility? Can they get to a website? What does this group do? Mail can work in some settings. It doesn't work for everybody, interestingly enough. Some populations, for whatever reason, the mail tends to not get through very well. Maybe just flyers, brochures, and handouts that get put in various settings, or through organizations or community service providers. A few years ago, I was working on I was the director of the Prevention Research Center here on campus, and one of the things that we were doing, we were working in a particular area in South Columbus, and we were doing a number of studies that had to do with childhood obesity, a number of related studies in the area. One of the things we did was a survey of parents of preschool-age children. When we finished that survey, whoa, it's got a mind of its own all of a sudden. When we finished that survey, we communicated results in a couple of different ways. We made these brochures, first of all, which had two different audiences in mind. This one on this side, this one, was for the parents, not only the parents who participated in this study, but any parent in the community that was interested. And what we did was we took some of the survey results and we kind of integrated them with what we knew was sort of APA recommended best practices for parents, and we sort of mooshed it all together into this brochure. And we tried different versions of this brochures with community groups over and over and over again until we had something that everybody was, okay, this is good, we understand this. And, it might not have been my preferred way of communicating the data, but it was the preferred way of the community to get the data. So we shared it that way. We handed these out not only to the people who had participated, but generally to any community organization that wanted them. So we distributed them in a number of different forums. We also made this other brochure, this one over here, which had more to do with community resources rather than specific survey results of the parents, and was based on some provider interviews and some focus groups and things that we had done. And that was a briefer one that we shared with service providers. We got a whole bunch of people from the city government to sit and listen to us. And we used a variety of ways of sharing that data and shared it both in written and verbal format. So same project, different results communicated in different ways. Oops. All right. All right. Similarly, in the same project, we did surveys of child care providers, daycares, things like that. And one of our partnering groups were people who actually worked with, that slide just does not want to stay put, worked with child care providers, and they wanted it in two separate formats, one that they could use while working with family daycare homes and one they could use while working with the big centers. So we actually separated our results the way they wanted them and did two different versions of the results, and one oriented around family homes and one oriented around centers that our partnering groups could then use in working with those different group organizations. So again, that wasn't necessarily the way we had planned to analyze and distribute the data, but it's what the community groups wanted. When I get it to stay on that slide, then it won't go forward. Then it goes forward all by itself. Okay. Community meetings can work, and sometimes in conjunction with written materials. I think community meetings work better in concept than they do in practice, because frankly, you're probably, if you try to hold a community meeting to talk about results, you're not going to get a ton of attendance. We never have, even though people tell us, oh, definitely, come and present this, and you get a handful of people. I think that you made the effort is appreciated beyond the size of the audience that you actually get. And again, you may have to have multiple sessions with multiple different groups. We've done, with the different projects, we've done sessions with, like I say, city leaders and health daycare providers and parents and so forth, talking about results pertaining to all those groups. A couple years ago, when I was at the University of Minnesota, I was involved with a study called Little Ears, which was a study of otitis media in Native American children. And we were working with 3 different Indian reservations and an urban Indian community. And we, at the end of the study, traveled around the state and made presentations on each of the separate reservations and in the urban area, and separate presentations for the community residents and for the healthcare providers. And it was an interesting experience because in most of the reservations, the only large building available is the casino. So a lot of our presentations were in the casinos, which was just like a whole cultural trip. With the Prevention Research Center, as I said, we did separate presentations for a number of different kinds of groups. And again, none of these were huge attendance presentations, but again, I think the fact that we showed up at the end and were willing to do this carried a lot of weight in the communities beyond the number of people who showed up. The final strategy, and I don't have any particular experience with this, but depending on what type of research you're doing, it's probably worth thinking about, is inclusion of participants, and particularly this may have to do with patient groups, depending on your type of research, in scientific meetings, which can involve separate sessions for patient groups in terms of understanding and using results of scientific studies, or can involve patients giving feedback about their interpretation of the findings. Like I said, don't have any direct experience with this approach. At the end of the slide, I've got a couple of references, and there is a paper included there that talks about how people have done this and what their experience has been. There are complexities to doing this, and the big one is timing. You want to share the results, you are almost always doing it after the funding is over. So how do you get your act together to do this? And it needs to be thought out in advance. I'm going to have to do this kind of presentation at a point where my project is out of money. Where are the resources going to come from to do this? And you may need to work with your grants administrator to see if you can figure out a way to use other resources to do this, because you may be beyond the end of your funding. And it's particularly a problem if you have to create brochures, or you have to get them printed, or if you have to travel to meet with groups and so forth. But if you think about it in advance, you're going to be better off than if you wait until, whoops, the money's gone, now what do I do? The other problem, of course, is the problem of the data not being ready to disseminate and the community being ready for feedback, and how do you deal with that? And the concern that a lot of researchers have expressed is, is this somehow prior publication? Probably not, but if you attract media attention and you're not ready to if your research is not fully digested and ready to disseminate, that might not be a great idea. A lot of times it's best to wait until the papers are written and submitted, and at that point you do the communication, and you can be 2-3 years down the road at that point. We all know that. So if that's going to be the case, then you probably need to let your community partners know in advance. Yes, we will come and share data, but it won't be until so many years out from the end of the study. So that's when it will happen. It kind of depends on what kind of results you've got, whether there's something you can present early that maybe doesn't represent the full study findings, but represents some things that the community will find interesting and useful. It's going to vary depending on your project. Types of findings. As we all know, sometimes you don't find what you thought you were going to find. It didn't work out the way you thought it was going to work out. So then what do you share? And it's more difficult to go around sharing results when the results are not, hooray, we've solved the problem kind of results, when they're sort of, oh, it's more complicated than we thought kind of results. But, again, I think we have to think of a way to say that in a way that doesn't discourage the community and helps them to understand that research means what it says. We are searching for results. It doesn't always work out the way we think it's going to. And then the motivation, obviously, as university researchers, you've got all kinds of other pressures and priorities. This might not be it. And the motivation to do this, there might not be a lot of incentive there. And in fact, some researchers have expressed concern that, if I start talking about the results of this research, I'm going to get swamped by people who want to be involved in a study that I don't have going. My study's over. And I've never had that particular problem, but it has been a concern for some individuals. But there are benefits. If you do it, if you take the trouble to do it, you're likely to be welcome to work with this community again. And the next researcher who wants to work in this problem in this community might be welcome to work there again, because people feel valued by the fact that you took the time to come and share this data with them. Sometimes I've had the experience, and again, it's kind of probably specific to the kinds of research I do, that people were able to give me insights into the meanings of findings that I might not have thought of on my own. So it can be useful in that way as well. Is it required? In general, no, or at least not yet. As Jeff kind of alluded to, NIH is starting to, in at least some kinds of research, require a plan for dissemination, not only to the scientific community, but to the larger community or to the participants. So it is a skill that's worth cultivating, or something that's at least worth thinking about. The reasons to do it, respect for persons, which is, one of the mantras of human subjects research. The fact that there are demands by various communities and activist groups that we, be more forthcoming about what we are learning from our research, and that some funders are very specific about wanting people to share these kinds of results. So things that I've learned along the way from doing this: plan from the beginning. Think about the time that it's going to take and the funding that's going to need to be there after the funding is gone. You may have to get permission up front if you're planning to send people results who were the individual study participants. You may have to include up front in the consent form permission to do that. So we just put it right in our consent form. check here if you wish to obtain a study results at the end of the study. Everybody always checks, but obviously they have the right to not get mailed study results. Communicate up front what the plan is going to be. Hey, I'm going to come and share these, but I won't be able to do that until 2022 or whatever it is, so that they know what to expect. And even if they don't seem all that interested, I think, like I said, making the effort is good community relations. So that's kind of brings my comments to an end, unless there are comments, questions, or things that people would like to share. Okay, well, as I said, I did at the end of the slide put a couple of key references that cover some of these kinds of issues, including the things that I alluded to that I myself don't have experience with. So if you're interested in following up, there's a couple of good papers there that you might want to look at. So thank you.